morning. My name is Stephanie Ellis. Today I'll be delivering my informative speech. I'm going to present to you my audience, consists of my coworkers, Zoe and Yadi. Thank you. Give me 1 minute. I'm just going to adjust my camera. Thank you. During my speech, I will be presenting my audience with visual aid using a PowerPoint presentation I have prepared on skin cancers. My speech is entitled Bringing Awareness to Skin Cancer, and I will begin. The specific purpose of my speech is to educate my audience on the 3 types of skin cancers and how they can be prevented. My central idea is that sun protection can decrease the risk of skin cancer. Now I will begin. Remember scraping your knees as a child? Your mom would clean up your wounds, apply a sunscreen, bandage, and suddenly that boo-boo was gone, making you feel all better again. What if I told you that simply applying a cream could prevent you from developing the most common cancer known to man? Skin cancer, that is. In the United States alone, more people are diagnosed with skin cancer each year than all cancers combined. In the year 2007, at the young age of 18, I became a registered medical assistant. Since then, I've been working with board-certified dermatologists and world-renowned dermatologists as well. And it's been 11 years. I assist daily in their practices with skin cancer screening, diagnosing, and treatment, as well as patient education. Skin cancer is on the rise and more common than you might think. So I hope to raise awareness among my classmates on this disease by discussing the 3 most common types, how to prevent them, and how to become aware of any suspicious spots on your body. So let's talk skin. Skin cancer is a tumor that's found on the top layer of the skin that's called the epidermis. Skin cancer occurs with cumulative exposure of the sun. There's 3 types of skin cancer. The most common type is the basal cell, followed by squamous cell carcinoma, and lastly, the infamous melanoma. Basal cell and squamous cell carcinomas are the most superficial type of skin cancers, usually referred to as non-melanoma skin cancers. Research states that 1 in 5 Americans will develop a skin cancer by the age of 70. All skin types are at risk for skin cancer. Melanoma is the most dangerous type of skin cancers. This type of skin cancer may spread to all parts of the body and can be proven to be fatal. Melanomas can appear as a new spot, a new lesion that pops out on your body, or it can be found in an existing mole. You can have a mole since birth and all of a sudden it becomes malignant and can turn into melanoma. So now that we've covered the type of skin cancers, let me teach you how to prevent them. So I'm sure you're probably wondering how something as minor as a silly cream can protect us from a sun that's so powerful that it heats up the whole entire planet. So fair enough, let me explain to you the power of this cream. Not all sunscreens are created equal. A broad spectrum, as you've probably heard, the term broad spectrum, sunscreen with a sun protection factor, which you commonly hear as SPF, of 30 or higher will protect you from harmful UVA and UVB radiation that the sun emits. You also have a choice between choosing a chemical or a physical sunscreen. Chemical sunscreens absorb the sun and it protects you from the penetration of those damaging rays, while the physical sunscreen will deflect the sun rays, kind of think of it as a disco ball reflecting the sunlight. For extra assurance, knowing that there's so many different types of sunscreen options out there, look for a purple label. Looks like this. It's from the Skin Cancer Foundation, and it is their official seal of recommendation. So no matter which sunscreen you choose, the most important things are to be sure you reapply every 2 hours or after swimming or excessive sweating. Whenever it's possible, try to wear UPF, ultraviolet protective clothing. Columbia is a brand that's very common for developing a great line of sun protection clothing. And always seek shade when possible and avoid peak sunlight hours of 10 a.m. to 4 p.m. Regular use of sunscreen is proven to reduce the risk of skin cancer, but we cannot block out the sun in its totality because it is so powerful. For this reason, it's important to have regular skin exams. An annual skin exam is recommended for every adult, every year, or at least every 3 years. Yearly if the patient is at high risk or has had previous skin cancers or a family history of melanoma. These skin exams can result in possible life-saving early detection of skin cancers. Monthly exams can also be performed at home. To perform a monthly exam, simply look at yourself in the mirror. Make sure you raise your arms, check under your arms, your feet, between your toes. You can use a smaller mirror with a large mirror and check your back as well. Schedule an appointment with your local dermatologist for a routine skin exam if you've never had one. And should you notice any moles in your body that are growing, changing, or bleeding, definitely schedule an appointment sooner. Follow the ABCDEs of melanoma guidelines. To become aware of any moles on your bodies that are changing. The ABCDEs consist of A for asymmetry, B for border, C for color, E for evolving. So evolving, anything growing, changing, or bleeding. These are signs that a mole should be further looked at by a dermatologist. So to summarize, I've covered the 3 types of skin cancers, how we can prevent them with proper sun protection, and how to be preventive and seek regular skin exams. In short, fun in the sun is great, but safe fun in the sun is even better. We only get one skin, so protect the skin that we're in. Thank you.